Hi, welcome to this episode of Patient Education for the Educated Patient. In this episode, we're going to talk about the Induction of Labor Calculator. This is a nifty little tool to calculate your risk of C-section if you have to or want to undergo a induction of labor. So let's talk about the take-home points. As elective induction of labor becomes more common, especially after the ARRIVE trial, the calculator can help you decide what to do. Should you get induced or should you not? This will give you some reference point to help make a more educated decision than, for example, flipping a coin. So some variables in this calculator you can control. Some of them are fixed. Some of them make a big difference, like your weight gain, your obesity, your BMI. And some of them don't make a big difference, deciding whether to induce before or after 40 weeks of gestation, for example. Induction is getting more and more common, whether it's because patients are more accustomed to interventions, or if it's because they want to avoid a stillbirth, or they just don't want to be pregnant anymore, or they see things like the ARRIVE trial demonstrating a lower risk of C-section with induction of labor at 39 weeks instead of waiting. So this calculator was created at the University of Pennsylvania, and at UPenn, they created a calculator based on one data set and validated it with a second data set. So it's actually a very good calculator and it's fairly accurate based on its validation. So they started with their own data set from a trial called 4Mommy. This 4Mommy trial was done at UPenn and they used it to create this calculator. Then they ran another set of data through the calculator from the Consortium for Safe Labor. That's a publicly available data set. And they actually had a very, very high correlation in terms of predicting who was going to wind up with a C-section if they were induced. So again, the 4Mommy data set was a trial that stood for Foley or misoprostol for management of induction. They were looking at 4 different induction of labor methods to see which ones were the most effective, fastest, without increasing your risk for C-section, etc. So this was done at UPenn. So UPenn had access to this data set. They created this calculator based on that data set. And then again, they ran another set of data through there to validate their calculator. So which variables were tested? They had access to a lot of data, so they had to see which variables should they actually use to make this calculator as efficient as possible. So they tested several things and looked at the correlation of each of these variables to risks of vaginal delivery or C-section. And they found the ones with the highest correlations, and those turned out to be the maternal height, the BMI at delivery, or at least close to delivery within a couple of weeks, whether this was the first delivery or subsequent delivery. And that's important because this data set is not meant to be applied to patients who broke their bag of water or had a history of a C-section. So those patients need to be excluded from this calculator because they were not validated with this calculator itself. On a side note, there is a separate VBAC calculator for patients who've had a previous C-section who wish to undergo a trial of labor after C-section in hopes of delivering vaginally with a previous history of a C-section. And we can talk about that in a separate episode. But continuing with variables for this calculator, the gestational age above or below 40 weeks of gestation, and then the modified Bishop score. So they looked at these 5 variables and they came up with this calculator based on, again, the nulliparity, the gestational age above or below 40 weeks of gestation, the BMI at the time of delivery, the maternal height, and the modified Bishop score. So when you look at that on a normogram, what does that look like? On the top line, this is the modified Bishop score, gestational age, nulliparity, BMI, and height. And your total score correlates to the probability of having a C-section. So this is the probability of having a C-section. This is 5% over here. This is 80% on this end. So you just add up all the points. So The closer you are to the left on this axis over here, the lower your risk of C-section. Over here, the higher the risk of C-section. So you can see, like we talked about in the take-home points, that things that you can control, for example, for an elective delivery, do you want to be induced at 39 weeks or 41 weeks? You may have a bigger baby or an older placenta at 41 weeks, but ultimately the difference is very small. The length of the line being very short. Things that make you very high risk for C-section have a very long line. So that would be first-time moms, patients with high BMIs, or patients with a very unfavorable cervix. Short patients, these are things that go towards the right end of the nomogram, which increases your risk for C-section. So again, deciding whether to induce before or after 40 weeks is actually a variable that contributes the least to whether or not you're going to wind up with a C-section or not. So then again, they took their calculator, they ran in a publicly available data set from the Consortium for Safe Labor, and they actually had a very high correlation with what actually happened. Here, the x-axis is the probability of the C-section based on their calculator. On the y-axis was the actual C-section rate, and you can see if the calculator said less than 10%, sure enough, actually it was less than 10%, 10 to 20%, it was 10 to 20%, 20 to 30%, 20 to 30%. So you can see a high degree of correlation between the calculator and the actual C-section rate. And when the calculator said your risk was greater than 80%, well, your C-section rate was 100%. So this is not only a good calculator, but it has been validated. Keep in mind the people that were excluded from this calculator, people who broke their bag of water, and people with a history of a C-section. But other than that, this is a very good calculator to help you decide whether or not an elective induction is right for you. Otherwise, if you have to be induced because of diabetes or high blood pressure, this might provide some information for you, but your back's kind of against the wall. You should be induced anyways, if that's what your doctor is recommending. So here's the website, and the URL is listed right here, and I'll put it in the description and maybe a comment. But it's very simple. You go to this website, you punch in the maternal height, the BMI. Is this your first pregnancy? Are you above or below 40 weeks of gestation? And then the modified Bishop score. This requires a vaginal exam or a cervical exam by your obstetrician or provider. And we just need to know your dilation, your effacement, or the length of the cervix, and finally the station. And that will actually punch out a risk for C-section. And again, if this is a purely elective induction of labor, that number might help you decide whether or not it's a good idea or a bad idea. So again, the take-home points: as elective induction of labor becomes more common, especially after the ARRIVE trial, this calculator can help you decide what to do if you're considering an elective induction of labor. Of these 5 variables that go into the calculator, some of them you can control, some of them you can't, like your height and your cervical exam. But the 2 things that you can control is, again, making sure your BMI doesn't get out of control during the pregnancy. But the decision whether to induce before or after 40 weeks, again, only applies to elective inductions, makes the least amount of difference in your risk of having a C-section. So that concludes this episode. Hopefully you found that helpful. And if you need that calculator, again, it's available to everybody online. If you have any questions about it, feel free to leave me some comments. Again, I hope this will help you tailor your care and your decision-making to your unique situation for you and your baby. Hope to see you at the next episode. Until then, stay healthy and stay educated. Thank you for watching this episode of Patient Education for the Educated Patient. I hope you found this content both helpful and meaningful, and that you'll be able to use it to live a healthier life. If there's any questions, please leave them in the comments section below. I do welcome feedback, so please also leave me any comments or suggestions in the comments section. Please subscribe and turn on the notifications, and I hope to see you at the next episode. Until then, Stay healthy and stay educated.